Welcome to the Along the Gravel Road podcast. I'm your host, Chelsea Barona. Thanks so much for joining us today. We took a little bit of a hiatus over the summer, but we are back to talk about all things mental health. Today's guest is Dr. Enrique Flechas, and he received his medical degree from LSU School of Medicine in New Orleans and completed a psychiatry residency at Ochsner Hospital in New Orleans. He was in private psychiatric practice here in Baton Rouge until recently joining Women's Hospital last year to focus on women's mental health care. He specializes in perinatal mental health and really wants to help people understand anxiety, depression, and all these other mental health issues that are related to both pregnancy and postpartum and when people should seek mental health care. And so I'm really excited to talk about this topic today. It definitely is something really close to my heart. I think maternal mental health is a topic that obviously impacts so many people, but yet it isn't a focus as much. We really focus on the baby, and which is great. Obviously, they need our support, but I think as new moms are going through this, there's a lot of things that come up that you don't realize are going to come up. So I'm really excited to have this conversation today, and thank you so much for being here, Dr. Flechas.
Thank you for having me.
Of course. So let's see. We're going to go through just a few questions for you, but I think let's just jump in with a brief introduction. If you could introduce yourself, a little bit about your work, and kind of tell us what you're going to talk to us about today.
My name is Dr. Enrique Flechas, as you said. I've been a psychiatrist for 20 plus years, and I was in practice here in Baton Rouge. And over time, I realized I was seeing more and more women, and more women actually were coming to see me related to mental health during pregnancy, postpartum. And I realized there was not a lot of clinicians that were comfortable treating this in the community. And so as I started doing more of that, I had more and more interest in it. And when an opportunity presented itself to be able to join Women's, I did so about a year ago.
Before we jump in, I do want to talk about an amazing production company that is producing this podcast, Ray Media Group. If you're looking for a company that can deliver an amazing product and an experience, then Ray Media Group is who you need to call. They specialize in weddings, podcasts, commercials, YouTube, business promotions, and it's really been great to work with a company who strives to create this experience for their clients. And so you're not just a number to them. They take the time to build these relationships. Trust me, I know from experience. We've been working together for a little bit now, and it's been amazing. And they put up with me, which is a great thing. So you can check out their website at raymediagroup.com. That's RHEA mediagroup.com, or give Ken a call at 225-772-7504. Very good. Thank you so much for being here. Like I said, there's been several experiences, especially over the last few years, where I myself am not a mom yet, but I've really, I've talked to so many people who are so scared to reach out for help. They don't understand what they're going through. They think there might be something failing as a parent a lot of times. And then even, as trying to be that supportive partner or that supportive friend in the process can be really difficult. And so I'm really glad that we're talking about this topic. I'm really glad that you were able to recognize kind of how important it was and that there was a gap here, because that's where we're going to eventually start leading to more support and it not being so stigmatized. What led you, so in addition to kind of hearing about all of these stories of, these pregnant people coming to you for support, was there anything else that really opened your eyes in this field or led you to this, or was that kind of the driving force?
A lot of it was the driving force, but I had so many experiences in dealing with women during pregnancy, and it was such a positive experience for me. It was very rewarding to be able to help them and realize that it really was a very underserved group of people. And so, what I've kind of learned as I've been working for Women's now is that many clinicians are really just not comfortable with it. And so very often they will say, well, you have to go back to your OBGYN during pregnancy if you have any mental health issues or postpartum. And a lot of times the OBGYNs are just inundated with that, and sometimes a little bit more complex. And so it's been nice to be able to fill that need.
What have you noticed? You mentioned the OBs and that being sort of the entry point into asking for that support. Is there training that goes into them being able to support mental health issues, or does that really fall under, someone like yourself or another mental health professional?
OBGYNs end up functioning as a primary care doctor for a lot of women these days. So what they practice is very often comprehensive women's health. As part of that, it's the screening process and awareness of mental health issues, both outside of pregnancy, but also even more importantly during pregnancy and postpartum. What we've really gotten much better at now is just offering screening tools and much more proactive in looking for and asking about postpartum depression. It's really been under-recognized because about 20% of women experience either depression during pregnancy or postpartum. And about 1% of those can even turn into something really significant. I'm sorry, requote that statistic, but it's really 1 in 1,000 women actually can end up with postpartum psychosis, which is a really serious condition.
Yeah, definitely. So I think that's a great segue or, responses because you start to recognize that, yes, primary care doctors and doctors they do have these amazing screening tools, which are great. But a lot of times the conversation has to start from the professional because we're just kind of going through the motions. And especially as a new mom who's getting all of these things thrown at her during pregnancy, they have no idea what's going on with them. Who knows to really say, oh, that was or how to identify, I might be depressed, unless someone asks the right questions, right? And, I see that a lot in all different spaces where people don't know what they don't know. And so they might think a lot of different things like, oh, this is just something I have to deal with, or there's something wrong with me. It's not, and they're embarrassed, or, this stigma is still there, right? And so what is your thoughts on, this stigma and that it's not talked about enough, and how do we as either the people going through it or trying to support those with maternal mental health issues, how do we make sure that these conversations are happening? How do we do better in supporting people who are dealing with this?
Yeah, and those are great points. The biggest thing we really see is not only the stigma of mental health in general, but a lot of women really feel like it's a failure as a mom, or I'm going to be judged if I have some struggles, that I'm supposed to be happy because I have a newborn at home, when in fact, all of these points in life are actually huge stressors.
I think knowing that, it needs to, hopefully there's things in place, because I imagine as, a mom who has been through postpartum depression, the fear around it happening again, knowing that that's a risk factor, only makes it even more difficult, and can definitely cause a lot of strain and everything in the process of deciding whether you want another child or not, I would imagine. And so, sort of like you were saying, this awareness and information, if new moms have all of this on the front end, or even just families in general have this information even talking about starting a family, you can better prepare for these types of things. And so being able to say, if you have some of these risk factors, these are the type of things we can put into place even before pregnancy or during pregnancy and afterward, so you can get through it. Because, as we know, depression, postpartum depression, these are things that we can live with. We often do, right? After we're diagnosed, there are a lot of things that you can put into place that can help you from getting into a depressive episode. And I imagine the same thing is true with postpartum, although I know the hormones obviously play a role in that. Can you talk a little bit about what women and family and their support systems can actively do either during it or beforehand to help prevent it from getting worse?
Yeah, I think the biggest thing is actually having a conversation ahead of time. So, if we know that there may be some potential risk for that, and part of planning for pregnancy in general, this would be one of those discussions to have. The other is just kind of recognizing that there are a number of things that can be done that don't necessarily have to involve being on medication. And very often that's a reason that some women are very reluctant to seek care for their depression or anxiety, either during pregnancy or postpartum, because of those concerns. There are many things, and even if we were to elect to put somebody on medicine that we deem that might be necessary, we still want to encourage them to do these other things. For example, exercise is a wonderful tool to help with depression. We know that if someone can exercise for 30 minutes about 4 times a week, it has a tremendous antidepressant effect. And because of that, of course, it's no exposure to the baby or concerns about health issues or things from being on a medication. The other is really, we recognize that sleep is such a huge factor. And in depression. And postpartum depression is associated with a lot more anxiety symptoms, a lot more worry, and a lot more restlessness than we see traditionally with depression. And so we know that just helping to make sure that you're going to be able to get adequate sleep, which is a challenge, of course, with a newborn, but that's where that support system from family or a partner really is invaluable. So in addressing sleep issues, whether that's environmentally or even with medication if needed, again, a huge way to treat it that doesn't mean having to get on antidepressant. The other things that we know are things that are mindfulness type things like yoga or meditation. There's so much stuff online nowadays and on apps for pretty much everything that can really be helpful with that. And we know those are also very helpful things. And of course, as probably you hear, is, having a good diet as well as another positive thing. Not always the easiest thing to accomplish if you're pregnant or just gave birth. So
Right. Well, great. Yeah, I know those are all really great practices. And obviously, putting them into place even before pregnancy, I think those are all things we can do every day. But you really are reminded how important it is to have those things in place because, without them, you're sort of already in a sort of less set up, wellness space to be able to then handle something that can hit you really hard. And I think as someone who suffers from depression, I've experienced the same thing that when I am feeling really healthy, that's when I need to put a lot of things in place or the things that I can in place so that when I'm not, I have these tools in my toolkit that can help me. And I think the same can be said for someone who is planning to get pregnant or, is recently pregnant, that to start putting those things in place as early as possible and continuing them on as best as you can, keeping some sort of routine if possible, especially, if you have someone that can support you through it and leaning on them a good bit. And you mentioned the anxiety. So I think that part is not as talked about. Postpartum depression is one of those phrases that I think we're very familiar with now, or we're starting to be. But I know I've heard from people who were, in pregnancy and their anxiety and the automatic thoughts and the intrusive thoughts were just very difficult to manage. And they didn't recognize, because they weren't depressed per se, that it was due to the pregnancy or the postpartum. They were thinking there was something wrong with them and they weren't equipped to be a mom now, which are, again, those intrusive thoughts. What are some of the things that you maybe do in your practice to help people with that anxiety? And how do you tell the difference between depression or anxiety or the combination?
yeah, and as you point out, anxiety during pregnancy is really very common in postpartum, much more so than depression issues. And probably about 40% of women during pregnancy experience some anxiety issues, and even a greater amount afterwards. So after in a postpartum period, and as I was saying earlier, that's a big factor that's involved in part of the symptoms with postpartum depression. So anxiety is different than depression in that depression is more the inability to enjoy something or not just feeling sad, but probably the biggest is just things that you used to look forward to, you don't enjoy anymore. You feel like I'm just not happy to be around my baby. It's okay at times to feel stressed, of course, by your infant, but you should be able to feel some joy and connection. And that's a big warning sign to us that that's more of a depression symptom. Anxiety, we look at it as more of the overthinking. That's typically the most common symptoms, over worry, ruminating about things, or constantly thinking of the worst case scenario, planning for the thing that, is unlikely to ever occur, but that's something that's constantly on your mind. And often that can be so distracting that it makes it hard to sleep or to be able to be present to do the things that you need to during the day. So anxiety is a much more common thing and definitely is a risk factor for the depression part. The things we were talking about earlier, making sure that you get enough sleep, which can often be difficult if you're anxious, but that's part of what we talk about, and maybe some sleep hygiene or some medications for sleep. But also, again, the exercise is a great tool to manage anxiety. So all those things we're talking about that help depression, actually by default, will generally help anxiety as well.
Yeah, definitely. Thank you. I think also a lot of this stuff it would probably be good or helpful for, new moms to really just hear they're not alone. To say that this is not something that, not only are you're not the only one going through it, but it's also normal. It's an experience that kind of comes with pregnancy, with postpartum, and you will get through it, you know? And so I think a lot of it's that, you know, you talked about mindfulness, and a lot of it is knowing that it's temporary, that these feelings that are happening so intensely in this moment will eventually pass. You won't feel like this forever. You'll start to fall into this position of being a new mom and what that means for you. Is there any other, when it comes to maternal mental health or perinatal mental health, is there any other things aside from the anxiety and depression that women should be looking out for, or their partners should be looking out for?
Yeah, and along those lines of talking about support system and partners, it's really important that partners make sure that they're checking in, that they're talking with the pregnant or postpartum person in their life, because a lot of times the problem is they don't feel comfortable in expressing it, or they're going to be judged by talking about it. So you have to create a safe environment to discuss that, and it's okay to have sometimes thoughts that you might find are a bit disturbing. That's not unusual, but to be able to talk about it, it helps to make sure that you're not keeping it inside and that it's growing or festering into more. So, again, I think that's a really important thing.
Yeah, definitely. I think that is the other piece of this puzzle too, is the partner or this, the friends or the family who want to be as supportive as possible, who want to also be able to recognize the signs, but maybe don't know exactly the best way to go about it. But it's really about just opening up yourself as this safe space to say, to not feel judged, because obviously, this person is already judging themselves as harshly as possible. So to be that person for somebody else, also as a partner, I would imagine also kind of taking some of the hits as they come, because obviously anger is going to be a side, something that comes up a lot in this process. The emotions are very kind of all over the place sometimes. And so to be that partner that can kind of do that in that space, but that means that the partner also has to be taking care of their own mental health and wellness. And so a lot of those same things, maybe there's some opportunity for the partners to do these things together, like the moving or activity or cooking, and having these things set up in place so that this support person has the tools they need to be able to support the new mom as well. And I think that those conversations, the same thing you were saying about the check-ins and this building a safe space, have to start happening before. Because when emotions get high and when things are just really escalated, that can be a really difficult time to come back to, the same thing about the tools. Putting them in place on the front end before you're really in it can give you a really good space to be able to be that supportive person that they need in that moment, which I think is also obviously a big part of this conversation too. So what if a new mom is, or a pregnant person is experiencing anything that they might be afraid or these symptoms? What is the steps that they need to go through to reach out for help?
Yeah, and I think that you kind of touched on it earlier of what to look for, both as the mom and as well as the partner or family members, is that we want to look to make sure that the person is actually present, that they're able to, the mom is be able to be there and be engaged with the baby, that they are not withdrawing. Whereas often we might see where they just start to have this aversion to want to be around the infant, just want to withdraw. Those are some warning signs. Or if you see a really dramatic change in behavior, that all of a sudden now they're starting to have kind of bizarre thinking, or that they might even be having some thoughts that entail harm to the infant. Now, interestingly, with anxiety, sometimes thoughts that we call ego dystonic, or thoughts that are not consistent with what you want to happen. For example, thoughts of something happening to the baby. And moms are very reluctant to say that they've had those thoughts or that passes through their mind. But the fact that those thoughts are worrisome to them and disturbing, those are signs that we are much less concerned about it. What we want to watch for are thoughts that they really are starting to embrace that and feel in some way that that's a positive thing, or somehow even having some hyper-religious delusions or other things. Those are signs of postpartum psychosis, and those are the things that we're really concerned with, because there's a very high risk of some things happening to the infant in that situation. So as I was saying earlier, postpartum psychosis happens about 1 in 1,000 births. However, within that, about 4% actually end up doing something to harm the infant. So it's something, definitely want to be mindful of. Biggest thing is just to look to make sure as a spouse or a loved one that you're just looking for some significant changes in behavior. And as the person experiencing it, it's okay to feel tired. It's okay to feel irritable. But when you find yourself saying, I just don't want to do anything, I'm fantasizing about, I just want to run away from the situation or my child, those are signs that maybe you need to have a discussion. It doesn't mean anything needs to happen, and it doesn't mean that that you have postpartum depression or anxiety, but it's, again, something that you want to say, okay, let's have a conversation, and maybe move up to saying, let me talk to my OB, or let them screen some questions about it. And if further treatment or evaluation needs to happen, then often they'll refer to somebody like myself to just explore that a little bit further.
So that's the first step, is obviously talk as a family, see, if something comes up as the partner in that situation, start having those conversations, and then the OB would be their next step to bring it up to their OB, or hopefully the OB is asking the questions during their follow-ups. And then after that, there's a referral to a mental health professional or a psychiatrist, however, that goes. We know that there's a shortage of mental health professionals right now. How is that impacting maternal mental health or pregnant women in postpartum?
Yeah, that is a significant issue. So fortunately, many OBs are really good at being able to manage a lot of these symptoms unless they get to be very complex or very resistant to treatment. So fortunately, they're first line, and they're able to really manage the majority of these cases without necessarily needing a lot of psychiatric input. The other thing is there are a lot more resources and access for therapy, and that's a huge component that's helpful. Again, there's a lot of steps we go to before it gets to be medication is really your only option. And I think that's such an important thing for women to understand. Just because you say I need help doesn't mean you have to be on an antidepressant medicine. Sometimes that is the case, but there's a lot of other things that can be done. So at least there's a lot more resources. We're fortunate in this area. There are a number of therapists. We have a lot in the community. So, and many of them are very skilled in working with women during pregnancy or postpartum. Unfortunately, there's not that many prescribing mental health professionals. And within them, there's a really small percentage of us who actually really deal with perinatal issues. So,
Yeah. Yeah. Well, hopefully that begins to shift and change as we have more conversations, as the awareness builds, knowing that such a large percentage of the population is potentially dealing with these issues or something, adjacent to them. And speaking of that, Women's did just announce the opening of their mental care unit. Can you talk a little bit about that? What's that look like? Who is that unit for? What are some of the benefits to having that within the hospital system itself?
yeah, I'm very excited about that. It is such a unique thing that when you really look at it, there's only a handful of facilities or units or programs in the whole country that offer treatment like this. And why it's so exciting is because we can often get women who are pregnant or maybe postpartum into regular psychiatric care during the first part of their pregnancy. What becomes a challenge is women who are in the very last part of their pregnancy. No facilities really are equipped to handle that. Or for women who have postpartum psychosis or more severe suicidal thoughts, they're just not really a good fit, and a lot of places are uncomfortable in being able to treat them. So there's only a handful of facilities or units in the country. And it's very exciting that Women's has actually embraced that because they become much, aware and really proactive in trying to manage all aspects of women's care, and mental health being one of those. So I'm very excited about it because it gives us a unique opportunity to be able to intervene in ways that we just couldn't before, provide help. Instead of kind of women often getting lost to follow up or falling through the cracks because we just didn't have the resources for that. So I'm very, very excited about that.
Yeah, that's amazing. And like I said, to see, a women's health facility that's focused on women, it's focused on pregnancy, to say this is an important part of the puzzle, and to recognize that again is telling the public, everyone in the community, that this is a priority. And that if you're the person going through it, you're a priority. And so it's just hopefully one of those things that continues growing, what we're able to do to support, new moms and pregnant people. So speaking of that, is there anything new or exciting that you're doing now that's coming up for you, or that, that maybe you're doing with your continuing education around perinatal mental health? Anything that you'd like to share with us about the field?
Yeah, I think what's really nice is we've traditionally up until now had just really regular antidepressants and different medicines. There's been a lot of research and knowledge, and now we've kind of learned that a lot of depression symptoms and postpartum things are really related to some hormonal or neurosteroid abnormalities. A few years ago, there was a medicine that came out called brexanolone. Excuse me. And that was really the only treatment we had that was fast acting for women who had significant postpartum depression. The problem with it was actually required you to be in the hospital, and it's an IV treatment only. Cost of that and just the accessibility and the ability to do it with a newborn were challenges. They've come out actually in the last month, actually the FDA approved zuranolone, which is actually a pill version of that essentially. And it allows women to be able to be at home, take the medications, and have a treatment that's very tailored specifically for postpartum depression. And because of the mechanism of action is different than traditional antidepressants, many women with postpartum depression respond very rapidly to it. So I'm very excited to see that we've got this as a new tool. I haven't had experience of being able to use it yet just because it's come out so recently. But I'm very excited to see. And that just kind of tells you there's so much more research and so much more resources put behind dealing with these issues now than there used to be.
Yeah, absolutely. That is incredibly exciting. I did read that somewhere. Because I think, again, it's obviously, we know that mental treatment for mental illness is not a one size fits all for anyone. So it's actually a bit more, much more difficult sometimes than to treat some of these, physical concerns. And especially for this group of people, for pregnant, postpartum people, it's so many factors that are impacting you. To be able to have another treatment option that can really get to something that I think can be very hard, difficult to deal with, hormones, and that piece of it is really incredible. And I'm always excited to see that the research and how it evolves and how it changes, especially in the mental health space, because I think for so long it was sort of just pretty stagnant. And we're seeing a lot more resources put towards it today, which is very exciting. As we wrap up here, if you had to pick one thing, what would be one takeaway that you want people to get from this episode?
I want it to, the biggest thing is I want people to recognize it's okay to reach out for help. Do not suffer in silence. There are so many options of things that can be done and so many resources. You just have to reach out for it. And part of it is to recognize it does not make you a bad mom if you feel like you need help. And that's been a hard thing for a lot of people to overcome, more so than the stigma of mental health. A lot of women just feel like they should be happy, they should be relaxed, all these things which are just not often the reality of the situation. So the biggest thing I'd want to really convey is ask for help, talk about what's going on. You'd be surprised at how much just that alone would help. But in addition to that, there are just so many other layers and steps that can be taken really to address this. You don't have to suffer in silence.
Absolutely. Yeah. Thank you so much. This was a fantastic conversation. I know it's gonna, help a lot of people just to sort of hear a lot of this information around something that, we should know, we should talk about it. No one should have fear around asking for help for. So thank you for being here today, Dr. Flechas.
Thank you so much for having me.
And thank you all for listening.